As of today, nearly 49% of eligible Hoosiers are vaccinated or have made an appointment to receive a vaccine. It's incredibly exciting to see those numbers increase. It's also exciting to know that by the end of the day, nearly 361,000 additional Hoosiers could be eligible for this life-saving vaccine if the ACIP and CDC approve the use of the Pfizer vaccine in children ages 12 to 15, as we expect will happen. We have made incredible progress as a state in our fight against this pandemic, but we still have a journey ahead of us, and we don't want to give up any ground. As of today, Indiana has reported almost 1,900 variant cases, up from 1,100 2 weeks ago. These include nearly 1,500 cases of the B.1.1.7 variant, which originated in the United Kingdom and is the dominant variant that we are seeing here in Indiana. 15 cases of the B.1351 variant, which originated in South Africa, and 120 cases of the P.1 variant that originated in Brazil. We have also had 250 cases involving the variants that were first detected in California. All of these variants have increased significantly over the past 2 weeks, and they now represent almost 42% of the samples that we have sequenced since the beginning of our starting to sequence. Our statewide positivity rate has also increased to 5.3%. This is a reflection of the variants, which are much more infectious, and a decline in the testing recently. When you test people who are sick, you expect to see more positives. We continue to provide counties with their color-coded maps so that we can monitor changes in COVID activity easily. You can see that the number of orange and yellow counties has changed again, which reflects a shift in COVID activity in some areas of the state. Our 2-score county map shows 6 counties in orange, down from 7 2 weeks ago, and 41 in blue, down from 52 on April the 28th. That leaves 45 in yellow. Our advisory map shows 10 counties in orange, which remains consistent, and 34 in blue, down from 37 2 weeks ago. That leaves 48 in yellow. When cases increase, we also see an uptick in hospitalizations due to COVID. The number of people currently hospitalized with COVID continues to hover around 900. It is still significantly lower than the nearly 3,500 Hoosiers that were hospitalized in late November, but it remains much higher than we were here in late March. The number of people being admitted each day due to COVID has doubled to more than 100 since March. As more COVID restrictions, these numbers warrant our continued attention. We want every Hoosier to be safe from COVID. That requires making the best use of mitigation strategies such as wearing a mask, regardless of whether it's required, because we know that masks, social distancing, and hand washing work. It also reinforces the need to increase our vaccination numbers statewide. You can see on this zip code level map that we have areas of the state with high uptake of vaccine, which is represented here with the darker blue and the lighter blue hues. But we also have many areas of those in red or orange where the vaccine uptake is low. We continue to work with community partners in those areas to bring our mobile clinics to those locations and ensure that vaccine is accessible to all. But as someone said to me recently, this isn't as easy as a field of dreams where you build it and they will come. We have largely reached the population that was eager to be first in line to be vaccinated. Now we're working on those who have been on the fence or who remain hesitant, and we're doing that one shot at a time. Overcoming vaccine hesitancy requires all of us working together to remove barriers, to debunk myths, and to focus on all of the benefits of getting vaccinated against COVID. For example, being fully immunized means you're protected from a disease that has claimed more than 13,000 lives here in Indiana. It means you can go out to dinner without worrying about social distancing and masks. It means your fully vaccinated student athlete won't have to miss practice or games or school if he or she is listed as a close contact to a positive case, so long as your child does not develop symptoms. It means that if you work in a long-term care facility, you do not have to undergo routine COVID testing if you're fully immunized. Currently, staff are subject to testing to up to twice a week, depending on the level of transmission in the county in which the facility is located. When we look at our data, Indiana ranks between 38th and 40th, the lower half, for hospitalizations, meaning higher hospitalization rates, higher positivity rates, and higher cases per capita. and the percentage of that population that is fully vaccinated. But we rank 19th in the percentage of new deaths, which I firmly believe reflects our early emphasis on vaccinating our most vulnerable Hoosiers. Vaccines work, and they represent a return to the normalcy that we all crave. I continue to encourage every Hoosier to take advantage of the more than 700 locations around the state that are now offering free COVID-19 vaccines. Remember, no appointments are necessary. You can walk up at almost every site. Adding the ability to simply walk up without registering has helped reduce wait times for vaccination appointments and has increased traffic at mass vaccination sites like the Indianapolis Motor Speedway, particularly among our communities of color. In allowing walk-ins, we know that there will be trade-offs. In this case, that means accepting a certain level of vaccine wastage for as long as the vaccines are packaged in multi-dose vials. We know that vaccine wastage may increase as the vaccine rollout continues because more providers, including smaller provider sites, are now receiving vaccine, because vial sizes for some vaccines have increased, like the Moderna. About a fourth of our doses we receive are now in 14-dose vials. And the vaccine vials may be opened without using every single dose. We've communicated to providers that while we want them to minimize wastage, they should not do so at the expense of getting a shot in the arm of someone who wants to be vaccinated. Providers should not miss any opportunity to vaccinate every eligible person who comes to a vaccination site, even if it means opening a multi-dose vial to administer that vaccine without having enough other people on hand to receive the remaining doses in that vial. Providers can minimize wastage in these instances by offering to vaccinate family members or friends who accompany patients to their medical visits, and by maintaining wait lists or even contacting people whose appointments are scheduled a few days later to see if they want to be moved up. I would much rather us administer that shot and have a couple of leftover doses than to turn that person away because we don't have takers for the remaining doses in a vial. I'm confident that our providers can be creative so that we can maximize every dose possible. Finally, I want to let you know about an update that is coming soon to our dashboard. As we begin vaccinating 12 to 15-year-olds, we want to also include information about the number of cases that we're seeing of multi-system inflammatory syndrome in children, or MIS-C. This is a condition in which different parts of the body can become inflamed, including the heart, lungs, kidneys, brains, and other organs. MIS-C is really related to this hyperimmune inflammation that results usually after exposure to COVID-19. We know that many children developing this condition had the virus that causes COVID-19 or had been around someone with COVID. To date, Indiana has had 89 cases in people under the age of 20. Nearly 2/3 of those cases have occurred in males. Thankfully, all of these individuals have been discharged from the hospital. We will add this to our dashboard in the coming days as yet another way to measure the effectiveness of vaccines in our younger populations. And now Dr. Weaver will give us additional vaccine updates.
Thank you, Dr. Box. Today marks the next step in our efforts to protect more Hoosiers against COVID-19. The CDC's Advisory Committee on Immunization Practices is meeting right now to review the FDA's extension of the emergency use authorization for the Pfizer vaccine that would make it available to children ages 12 to 15. We expect the CDC to sign off on this later today. Once that happens, we will update our website at rshot.in.gov so that as of 8 a.m. tomorrow, parents can register their child who is age 12 or older for an appointment. You also will be able to walk into a Pfizer site with a parent or guardian without an appointment. I am excited for this next step, both as a physician and as a parent. As a doctor, I know that the more people we protect from COVID, the fewer cases we will see, and our hospitalizations and deaths will decline. As a parent, I want my oldest daughter, who has been so worried for this past year, to finally have peace of mind. We hear daily about the sacrifices that families have made to protect their loved ones who have medical conditions that put them at greater risk of severe illness or death from COVID. In some cases, that has meant healthy children have remained virtual learners for more than a year to protect a high-risk sibling. In others, it has meant giving up cherished extracurricular activities such as athletics or show choir. Expanding the vaccine to younger Hoosiers will help our children start getting back to the activities they love. It will help them to have a summer that is focused on quality time and not quarantine. It also will help ensure that the next school year looks much different for our students, teachers, and staff. We all want that normalcy, and the best way to get there is to increase the number of people who are fully vaccinated. As you can see, our older Hoosiers are still leading the way in the percentage of the population vaccinated. 76% of Hoosiers age 80 and older have received or scheduled a vaccine. 80% of those ages 70 to 79 have done so. And 70% of those ages 60 to 69 have scheduled or received a vaccine. We have seen a slight increase in vaccine uptake among younger groups, but we still have a lot of work to do. So far, 53% of Hoosiers age 50 to 59 have scheduled a vaccine, and 42% of people in their 40s have done so. We have seen the percentage of those in their 30s who are getting vaccinated increase to 36%. We now have 30% of people in their 20s signed up or vaccinated, and 27% of those ages 16 to 19 have done so. In total, nearly 49% of eligible Hoosiers are vaccinated, in the process of being vaccinated, or have made an appointment. We have plenty of vaccine available to us, but we are ordering responsibly so that we are not hoarding doses or increasing our risk of having vaccine go unused or expire. As you are aware, the federal government has begun reallocating doses of vaccines from states where demand has waned to areas with higher need. To date, Indiana has pulled down 82% of its available vaccine, but many of our vaccine providers have not placed new orders because they have adequate supplies on hand as appointments have declined. Last week, we saw roughly 19% decrease in overall doses administered from the previous week. But second doses uptake remain high, with about 92% of people getting their second dose. Our 211 system continues to reach out to people who are late for their second dose to help those individuals get scheduled. When we are deciding how many doses to order each week, we look at scheduled appointments and add a percentage to account for walk-ins. We also compare those numbers to existing inventory, which we ask providers to give us each week. That helps us to know whether a certain vaccine is running low in an area so we can replenish supplies when needed. This week, we also have looked at availability of Pfizer vaccine across the state in anticipation of the CDC's approval of the vaccine's use for 12 to 15-year-olds. Our goal is to ensure that Pfizer is available at every local health department. To achieve this goal, we are sending Pfizer vaccine to local health departments in 30 counties that do not have any Pfizer providers. Those doses will arrive on Thursday. We also are sending the same number, we're also sending vaccine Pfizer to the other local health departments that will arrive on Monday, and we'll be ensuring that each of our mobile units carry Pfizer. Having this vaccine available will ensure that counties and local health departments can administer vaccine to all ages so that no vaccination opportunity is missed. As we work to promote awareness of the efficacy of vaccine, we continue to have our data team examine our data. One of the most recent efforts has been to calculate the odds of getting COVID with and without the vaccine. Our findings show that unvaccinated Hoosiers make up 99.3% of COVID-19 cases in Indiana. If you are not vaccinated, your odds of getting COVID are 1 in 29, while your odds of being hospitalized with COVID are approximately 1 in 525. And if you are fully immunized, your odds of being hospitalized decrease to 1 in 50,394. Please don't gamble with your health or with the health of your loved ones. We have more than 700 vaccination locations around the state that are available for walk-ins. Many sites offer more than one type of vaccine for Hoosiers who have a preference of one manufacturer over the other, and we continue to put mobile clinics in communities where the need exists. None of these efforts would be possible without the incredible partnerships from across the state. But ultimately, how quickly we are able to put this pandemic behind us will depend on every eligible Hoosier making the choice to get protected from COVID-19.